Welcome to the University of Pennsylvania School of Dental Medicine's Advanced Simulation Laboratory. The purpose of this presentation is to introduce you to our state-of-the-art advanced simulation facility and explain how the School of Dental Medicine has incorporated this technology into its curriculum. I will describe to you how it works and point out the difference between this laboratory and other simulation laboratories. The University of Pennsylvania is the only dental school in the country that has this state-of-the-art virtual reality technology to teach our students psychomotor skills. These Simodont trainers have been used in dental schools in Europe and Asia for some time. After the School of Dental Medicine tested these dental trainers for 2 years, we saw positive outcomes and a student's preference over our older advanced simulation system. We have now acquired this new advanced simulation laboratory with 12 Simodont trainers. We are the first dental school in North and South America to embed this technology into the curriculum as a formal course for preclinical students. Within the first few weeks of dental school, first-year students rotate through this laboratory and they learn preparation skills that will ready them for the traditional preclinical laboratory courses and also for future treatment of patients in the clinic. In this laboratory, advanced engineering recreates the dental tool and the object being worked on in virtual reality. The Simodont trainer provides real-time duplication of what the student is actually preparing. At the same time, and most importantly, the trainer utilizes haptic technology, which is the duplication of the real-time sensation of touch, to recreate the feeling of the procedure that's being done, just as it would be in a real patient. The dental trainer utilizes different dental tools, whether it's a handpiece, a dental explorer, or other dental hand instruments, and it recreates the sensation of this instrument working on all the different structures of the teeth. The Simodont dental trainer not only can train psychomotor skills, but it also enhances critical thinking. It has programmed dental case scenarios and procedures. Patient histories, clinical findings, radiographs are all presented. The dental student is prompted to answer questions regarding caryology, diagnosis, and treatment planning based on each of the individual clinical cases. There are many different procedures to choose from. The incorporation of the Advanced Simulation Laboratory into the curriculum here has proven to be valuable in many ways. The Simodont trainer gives a student early exposure to and instruction of psychomotor skills with direct and indirect vision. It allows the student to be familiar with tooth preparation so that the student can be better prepared when the fast-paced traditional preclinical laboratories begin. It can identify early on students that are facing difficulties gaining psychomotor skills. So early remediation can be given to them to strengthen the students' chances of performing successfully in the traditional preclinical laboratories and also in their clinical years. And very importantly, it realistically simulates the feeling of dental caries, the different dental tissues with various dental tools, and even a pulpal exposure, so it allows a student to be familiar with real tooth preparations versus practicing on a traditional plastic tooth, where everything feels artificial. This allows a student to be better prepared for treating real patients in the clinical setting. It won't be the first time they've experienced this feeling.
The Simodont system uses case-based simulation. So a lot of the cases that arise on the system are also present in the clinic, and you have very similar situations. So it definitely has made me feel more comfortable with my transition into the clinic, as well as more prepared.
Simodont's really exciting in the pre-clinic because traditionally the only option that dental students have is to use plastic teeth, which we can use our instruments to measure maybe a certain amount of millimeters or how much we're cutting. But the Simodont allows us to actually simulate a real tooth in the way that enamel would feel on the outside of the tooth versus drilling into the dentin, or even if we go too deep and possibly have a pulp exposure. So it's really amazing to be able to gain that tactile sensation when we're learning our hand skills preclinically.
The mission of Penn Dental Medicine is to educate dental students in the best possible educational, best possible clinical, and best possible research background. And this virtual environment that we have here allows them to practice 24/7 anytime they want in order that they can hone those skills so that they can serve better the patients that they will be treating in the teaching clinics.
Another advantage of the Simodont system is that students can come in here after hours or before they have a big procedure in the clinic and practice those procedures before they work on their own patients.
The units provide you with different case scenarios that give you different types of procedures that you can work on, as well as the background information, including the x-rays and the patient's past medical history. And all of this gives you a really well-rounded idea of what it's like to work with the patient.
The University of Pennsylvania is using this advanced technology to achieve its goal to train future generations of dentists that are outstanding in their field.